For anybody just popping in, we are waiting until 8:05 for the last bit of the guests to trickle in.
Much better. We cannot be blinded by the lights that are coming from the blinds behind me. How's everyone doing today? Thank you all for joining us. We're really excited to have Dr. Farber here to be kicking off our AAPI Heritage Month panelist series, just to discuss her journey through veterinary medicine as an AAPI professional. I've had the pleasure of working with her for my clinical year at NC State, and she was fantastic. And so I'm glad that all of you guys will get to know her as well. So we have a list of questions pre-formed that we're going to ask her, but if you think of any additional ones, feel free to type them in the chat. Hira, our co-founder, is going to be monitoring the chat for us. And so she will be sure to get those asked at the end. So a quick little intro about Dr. Farber. She is a first-generation Korean American who grew up in Los Angeles, California. Woot woot. She obtained her undergraduate degree at Cornell University and obtained her DVM at North Carolina State University, completed a rotating internship at Blue Pearl in New York City, and then returned to NC State for radiology residency, where she's currently a second-year resident. And her husband have two adorable corgis. You should follow her on Instagram, the Corgi Professor. But yeah, so without further ado, Dr. Farber, if you want to take it away and tell us a little bit about yourself.
Yeah, Aapi, thanks for having me, both you and Hira. It's great to be here. And also, you guys can just call me Esther. I don't think anyone's called me Dr. Farber since my internship, so it like weirds me out. Yeah, so as Aapi said, I was born and raised in LA. I basically, for like 18 years. My parents are both Korean immigrants. They moved to LA in their 20s separately. They, were in LA. They got married. They met and got married in LA, and then had me. I feel like this might be the case for a lot of other AAPI veterinary professionals. I never really grew up with animals. Like they just, like we had a dog when I was like 2 or 3. I have like pictures with it, and I don't remember anything about having that dog, but like my parents didn't really have pets. Like my mom's just like, oh, too much hair, like it's just too much work. It just wasn't a thing. But somehow I still decided in high school that I wanted to be a veterinarian. My parents wanted me to be a doctor, no surprise there. Eventually they came around to that idea and, supported me, and they still obviously support me now. So I went to Cornell for undergraduate. I kind of wanted to like get away from LA after being there for like 18 or so years. Graduated, and then I had always had the intention of taking like a 1.5 years off. I wanted to just gain more experience before applying to vet school. I was really into riding horses at the time. So I spent some time as a working student, did like some, internships and externships. And then at that time, I don't know why I thought this was a good idea, but I only applied to one vet school. I only applied to UC Davis. And I guess I was just too cocky, but I just applied to one school. I was like, I'll be fine if I don't get in, I'll just apply, the next time. And I got waitlisted. So then I was like, oh, okay, I got to rethink my strategy here. So I ended up taking about like a 2.5 years off, but it was, no regrets there. I did some more like internships and externships. I worked at like a small animal SPCA in Berkeley for like 6 to 8 months or something like that. Just like did little things here and there. And then I ended up getting accepted to NC State, which was an awesome experience. The only real like small animal veterinary experience I feel like I had was when I was in high school. I decided I wanted to learn what it was like to work for a veterinarian. So I started shadowing this practice in LA, and there were 2 veterinarians, and one of them happened to be a Japanese American. And so, growing up in LA, like I feel like I kind of lived in a bubble. Like I was surrounded by people of color. Koreatown has like, I don't know if this is still true, but it's got the largest population of Koreans outside of actual Korea. And so I just never really, racism wasn't really a thing I thought about. And then even like when I was working at a small animal hospital, the main vet I worked with was Japanese American. So I just didn't think anything of it. I was like, this is normal. And then when I went to Cornell for undergrad, again, like there's a pretty huge Asian American population there. So I was once again, like in my little bubble, didn't really think anything about it. And then I got to NCSU, and then that bubble kind of burst. And I realized how white the veterinary profession is. And especially like NC State, it's, it's in Raleigh, which is a relatively like relatively liberal city, compared to other places, but it's still the South. And one of the radiologists I work with jokes that that veterinary medicine is very homogeneously hyperechoic. It's like an ultrasound joke, but it's very homogeneously white. And so once I got to vet school, I was like, oh, this is the reality. It's, before it used to be white and male, and now it's really white and female, but it's still white. I was the only East Asian person in my class. We did have a South Asian classmate, and there was one Black female in our class. And so it was kind of like a little bit of a wake-up call. And then after that, I went to Blue Pearl in New York City, and then I was kind of once again put back into the little bubble of diversity. My intern class was pretty big. There were a few other Asian Americans, and then in the hospital that I worked at, one of the internists was Korean American, and one of the ER doctors also Korean American, a fellow critical care resident Korean, and so I was again kind of in the midst of other Asian Americans, which was nice.
Awesome. I think that is such a unique journey, and I think awesome for everyone to hear about. And also I shared a similar experience coming from LA and then moving outside of the bubble. And I feel exactly the same way, in LA, I'm like, oh, this is normal. Everyone is like mixed and everyone's here. And then going down to school in the Caribbean and then going to North Carolina was a bit of a wake-up call in a sense. So glad to know I'm not alone in that. Why did you choose radiology over all of the other specialties?
I'm a very visual person, and for me, radiology, and a couple of my resident mates are here, they can attest to this. It's like a puzzle. I mean, all of that medicine is a puzzle, right? You're trying to solve the case, etc. But for me, like, it's putting it all together that makes it so rewarding. And you kind of have to have your toes dipped into all the specialties. Like, it's not just knowing internal medicine or just cardiology. Like, there's really no specialty that doesn't use diagnostic imaging as a modality. You have to know a little bit about everything. I think maybe dermatology uses it the least, but we still get some derm cases. But you got to know a little bit about every specialty. And even though we're behind the scenes and the clients never see us, we're pretty crucial in terms of a patient's workup. And I like the fact that we have such a crucial role in patient care and management. The things that we interpret can make or break what a patient is going to do. Like, are we going to take this dog to surgery? Is this going to change the patient's chemo plan? So again, we're behind the scenes, but we have a pretty big impact on patient care. And so I love that, it's non-invasive for the most part. But we're pretty important. Just patting myself on the back.
No, absolutely. I mean, even at NC State, I think every service relies heavily on you guys, and it's like, okay, you guys be the eyes and tell us what's going on, because we have no idea. So obviously very valuable. I know that you said you had earlier when in your career, you had an AAPI mentor. Did you stay in contact with her? Did you find that was the case when you went back to New York? And you really only didn't have one when you were at NC State, or what are your thoughts there?
Yeah, I actually, I don't get to go back home very often. And when I do, it's kind of like limited. I'm limited in where I can go and stuff. So I haven't been able to really keep in touch as much as I would like to with the vet I initially worked with. This was, I guess, at this point, like 15 years ago, which is wild. And then during vet school, I didn't really have any API mentors, but I kind of casually keep in touch with a couple of the ER doctor, and the critical care resident. We just keep in touch on social media, but that's about it. I didn't really have any true, like in the classic sense, like API mentor. Certainly not during vet school.
I was about to ask Esther who that was at NC State.
Yeah, no,
I was like, there's nobody there.
Nobody. Hi, Karen. She was a year ahead of me at NC State. And are you still at Davis? I can't remember.
I'm finishing. Yeah, I'm in my last year of my surgery residency at Davis.
Yeah.
So I chose the other side, not radiology.
Karen was the only other Korean, right? Like that.
It was just you and me, dude. Yeah, it was you and me.
It's crazy.
Yeah.
Did both of you feel pretty isolated? Did you feel pretty accepted? Did you guys initially gravitate towards each other because of that reason, because of your shared heritage?
I mean, I don't know if we like gravitated toward, like we weren't like best friends or anything. Like,
Well,
we
we're
were
like in different classes, so it's like hard
yeah,
for
it's
us to
hard.
interact.
Yeah, like you become close, close with your own class. And then like there are some people who hang out with other classes, but I feel like we never really, maybe we should have spent more time together.
Dude, after what you went through.
Oh gosh, yeah.
Yeah.
We'll get to that.
Awesome. Okay. Well, along that same line, have you met any AAPI veterinary radiologists?
No, and I was trying to think about that. I don't think so. I mean, I feel like I know of one who completed the NC State residency program, but many years ago, but I don't actually know her. Like I've seen her on Zoom. But we've never really, there's someone, sorry, I just looked at the chat. There's some, but yeah, I haven't really like met one personally. It would be great to get in touch with them.
Something interesting that we were talking about is during our interviews and amongst the board is that in talking with a veterinary pathologist from UGA, she had mentioned that she never really realized how impactful it would be to have someone of AAPI heritage as both a colleague, because she's been in the veterinary field for quite a while, but both as a colleague and someone to look up to. And she didn't realize the impact that had on her until she was well into her career. Do you feel similarly in that vein? Do you feel that really wouldn't have made an impact for you?
Yeah, I guess it's hard to say, what it would have been like if I did have one, because I didn't. But I think, it would have, I want to say that like I would have felt less alone. And like, I feel like this is something that most of us in this profession go through, which is like imposter syndrome. I would have felt like, having someone to look up to and having someone mentor me, I think would have been really nice to, just nice to have, and maybe reduce a little bit of that feeling.
Yeah. Going back earlier, did you say your parents were pretty supportive of your decision to go into veterinary medicine versus something else?
Yeah, and this was, I think I want to say was during like middle of high school when I kind of decided like this is what I want to do. And I'm pretty stubborn when it comes to, when I set my mind to something, I go for it. And I think they kind of knew that. And that was actually, maybe this isn't something you should do, but like once I was like, this is what I want to do, and I'm going to start volunteering at a vet clinic, they were like, I guess we can get a dog. Maybe not the best thing to do, but like that's how I got my first actual dog. That's how I got my first corgi. So she's, been with me through all that. But anyway, that's kind of how it all started.
Nice. Okay. And then I guess moving into something you've already touched on again, how badly do you think AAPI representation is lacking in veterinary medicine?
Oh, it's pretty badly lacking. I mean, not just in vet med, but everywhere, obviously. I mean, I want to say it's getting better in the sense that I feel like I see more AAPI vet students every year. Again, I don't know what the class makeup here at NC State is, but I feel like I'm seeing more and more people. I think what we're lacking is like more AAPI in veterinary leadership, as well as like I'm including like faculty in there. So like we don't, how many AAPI people do you see teaching courses? Even just, other people of color, like Black and brown people of color. I think at NC State, there's one person. I don't even honestly know if he's still there, but everyone else is white. So I think that's where we're kind of, needing to fill that gap.
Yeah, absolutely. And that's something that, that we're hoping that with this next generation of veterinarians that comes out, we start to see that positive change in leadership higher up. So hopefully the field and our leadership becomes a little bit more reflective of the students and veterinarians in it within the next few years. So that's definitely something that we're working towards for the Aavmp. And the next question I want to ask you, have you ever faced any microaggressions during your journey through veterinary medicine?
Yeah, and actually, when I saw this question, I kind of struggled with it because I don't feel like, at least in vet school, I don't remember facing microaggressions. And maybe like growing up in general, there's just stuff like when you're young, people are like, oh, like you're tall, foreign Asian, your eyes are big, foreign Asian, like stuff like that, or like where are you really from, just like your kind of classic microaggressions. But maybe I just got lucky in the sense that like my classmates were actually quite wonderful, or maybe, they would think things but never actually say anything. Who knows? I don't feel like I actually, at least in my experience, didn't really encounter microaggressions per se. I don't know if anyone else can speak to their own experience. I don't want it to be just me, but yeah, I guess like there was, and I'm sure we're going to lead into this next, but like there was one pretty significant incident when I want to say I was a second year vet student, that had a pretty profound impact on me. And it was not a microaggression, but like a pretty blatant racist incident. Just like someone who is involved, like was associated with the vet school that I kind of knew, but wasn't like friends with or anything, but we knew each other. And there was some sort of like misunderstanding on that person's part. And it was like an unprovoked set of text messages that contained very racist language. And sorry, I'm gonna get all like this, whenever I think about it, it like gets me all worked up, but that was a pretty profound moment for me. Sorry, knew this was gonna happen.
No, that's okay.
I feel like it was kind of a huge wake-up call in the sense that, like, again, like I had grown up not really having experienced racism for the most part. Like I grew up in a bit of a bubble. And when that happened, I was just like shocked. And it's probably a naive thing to say, right? But it really like woke me up and made me realize like, oh, this is real. Like it can happen to really anyone.
Yeah. And
I'm sorry.
And don't
Esther, I also
don't
feel
apologize.
like admin like didn't handle that. Like I guess for everyone here, like I know the situation because I mean I was there, but for like Esther, it's like frustrating because it was a situation that admin also didn't. I feel like they should have handled the situation a lot better than they should have.
I mean,
just being like, you guys are adults. This is kind of like, it's, I guess, like, I don't know. That was just like frustrating. I feel like it may have been handled a little bit differently.
Yeah.
I mean, I'm not surprised with how it was handled, but that's like.
Yeah. And I can't really speak for like their part, what their thought process was or whatever. I did bring it to the attention of people higher up, and I feel like this kind of translates to like what's happening in, out in the real world as well, where like what happened wasn't considered hate speech. And they basically couldn't really take any real action because it happened outside of the school. And so that was kind of what it transpired. But yeah, it's just one of those things that like I'll never forget. And it affected me so much that like I actually struggled with mental health for a bit afterwards. I think it was like I don't know, 6-8 months after that, I did fall into a bit of a depression. I struggle with my relationships with friends. I'm better now, but it really affected me more than I expected to.
Yeah, and at the end of the day, you can't be expected to just have the thickest skins, like words hurt, and especially to come from a place where you've never experienced that, as you shouldn't have to, and going to a place where a colleague or someone that you're supposed to work with and you respect wholeheartedly comes from maybe a place of ignorance or a place of racism and says these hurtful words, like you can't just brush it off. We're all human, and it hurts so much. And it makes me so sad, that you're probably not alone in this situation, and so many others have experienced this, and it hurts at the end of the day. And you sit there at the end of the day and you're like, why is this happening to me? Like, what did I do to deserve this? And it's a question I ask myself all the time when I face these different, like similar things. So and everyone has said in the chat, thank you for sharing that, because you're not alone and we're here to support you through that. And again, I'm sorry that you went through that, but I am happy that you are able to share that now in the hopes of inspiring others, that like, you got to stand up against it. Disappointing that the administration didn't handle it as well as they should have. But again, whether that comes from a place of ignorance or they're just discomfort overall in addressing the situation and understanding how, like what their role is in that. And hopefully, again, over the next few years, what we can accomplish is showing the administration, how do you approach these situations? How do you stand up for AAPI people and people of color in general to make sure that we don't perpetuate these horrible incidences further on, So again, thank you for sharing that. And I'm sorry that you went through that. Do you have any advice that you would give to people who are in a similar situation as you? Like if they ever have to, unfortunately, experience something like that, what would you say to them?
Oh gosh. I guess it depends on, the specific situation. I think it's important to reach out to your family and friends and don't, internalize any of it. You talk to people. Just don't keep it all to yourself. And, if there's any like action that can be taken, like take the appropriate steps. But yeah, I guess in more, more general sense, I think we're we're at a bit of a tipping point in terms of just the way the API's community is sort of responding to everything. We're no longer, wanting to stay silent. Not that we wanted to stay silent, but we're more, we're fired up, right? And I think, at this point we're trying to, it's our job to educate and to educate ourselves. I still have so much to learn. I'm still learning a lot every day, but it's our job to learn and keep other people accountable. This is not just, random people you don't know on social media, but like family and friends, coworkers. When you hear microaggressions, you have to speak up. I think, having just discussions with other people, having, teaching them, not teaching them, but, educating them about like what the model minority myth is, which I feel like in vet med especially is kind of a big thing, because the people you see in vet med are the ones that are successful, or, you know what I mean? Like there's a certain, I don't know how to word this the right way. You only see a certain subset of people in vet med, and those are kind of, these are the people that are going to make it or whatever. So I think it's important to address the fact that, again, Asians are not a monolith. We don't all, go to 4-year colleges and have degrees and et cetera. I think it's also really important to take care of yourself. I think self-care is really important. It's especially now, like not only are we in a pandemic, the API community is hurting really badly. I think we just need to take care of ourselves and reach out to other people.
Yeah, I think that is all perfectly said and really well worded, and something that I think I got to work on a little bit more as well, is like taking care of myself. I get a little fired up when I hear microaggressions, especially because I'm half Japanese, half Greek. And so sometimes I hear microaggressions because I'm a little white passing, and people don't think that it affects me. And then I get a little fired up and I'm like, how would you feel if someone said that to you? And they're like, oh, like, why are you getting so upset about it? And I'm like, because it's ignorant. You don't understand how much your words can affect someone and have a lasting impact on people years later. And I think we want to work towards this society where everyone respects each other and everyone loves each other. And it can't happen if people continue to make these snide comments on the side, and it's frustrating. And so I get a little fired up, and then I go home and I sit like the angry fireman from Inside Out, that guy that has fire on his head.
I use that GIF all the time.
Me too. Me too. That's literally me. Stephanie and Hira can attest to that. I use it all the time. So I also need to work on that. So thank you for saying that.
Yeah. Sorry, going back to like what you're saying about people, saying, well, why are you upset about that? That's basically gaslighting, right? They're like invalidating your own feelings.
Exactly.
And so like, that's where we have to be like, like, you can't tell me how I should feel. You haven't experienced what I've experienced.
Yeah. So. I had someone one time, we were going out to dinner, and there was an Oriental night at the restaurant. And I had someone turn to me and say, oh, Oriental, is that what you are, Effie? And I just was looking at the person. I was like, I was like, where do I even begin with that statement? And I was like, sometimes I just take a deep breath and say, you know what, stop. But sometimes I feel like I need to be a little bit more vocal in this situation. But sometimes I think maybe my fears of standing up are at the fear of losing that friend, maybe if that conversation doesn't go well. I don't know if you feel the same way when maybe you're talking to people.
Yeah, and that's hard, you know, and again, I feel like that kind of, in a sense, goes back to the model minority myth, where we stay silent when we hear those microaggressions, and it further perpetuates that whole myth, right? We stay silent, we don't, you know, fight back essentially. And I feel like at this point, that's kind of what's changing now, and we're learning to properly respond to those types of comments instead of just being like, oh, haha. Like, I'm totally guilty of when, you know, at least when I was younger, feeding into those microaggressions and making jokes and like almost self-deprecating jokes and trying to like fit in with other white people, right? And I don't think I'm alone in that. Like, you make jokes about Asians in math and like you kind of go along with it, and that hurts all of us. And so I think, you know, by you're essentially pandering to the whiteness and staying silent, we're making we're further, you know, deepening those stereotypes. So I think part of our growth needs to involve learning how to respond to those people that we care about, not just like random strangers who yell things at you, but like learning how to have conversations about this sort of stuff with close family and friends.
Yeah, absolutely. I think this has all been wonderful. I would like to open the floor up now to any other questions that any of our attendees have. Feel free to write them either in the chat, or you're welcome to unmute if you'd like.
I do have to say, you're getting, oh, sorry, go ahead, Mark.
Hi, Dr. Farber. I am in NC State. I'm hoping to go to that school. I came all the way from California. I'm almost getting that residency.
Nice.
To get as in-state.
Wait, are you at NC State right now as a student, or?
No, I'm applying to NC State. I just got residency. I gave up 2 years. I moved from California, from San Francisco, to come and live in Raleigh. And my parents are like, why we don't go there? We don't go there. And I know several of the Asians in NC State in the veterinary school, and I want to ask, so what is your reaction when you see another Asian in veterinary medicine? What's your instant like emotion? It's
like pleasant surprise, I think. Like, oh, another Asian American. It's kind of like weird. And then I just like want to know, you know, and then I immediately, my head's like, where are they from? Like, you know, are they from like New York, New Jersey, California? Like, where are they from? Like, do I happen to, you know, like, do I know them in any sort of connection? I want to like ask, I have a lot of questions in my head that like never, you know, get said, but.
Anytime I see an Asian veterinary student or resident in a very PWI state, I instantly go into their DMs and it's like, what's the boba like? Where's the Asian supermarkets? Do I need to budget that in my yearly budget for my parents to send me ingredients to California? Because I like flavor.
Yeah, no, we have an H Mart here. I don't know if you know, in Cary. Okay, yeah, we live like,
yes,
like a few miles away. It's awesome. That's basically what we get, like our food. Well, I hope to see you here. Although I guess I should be, I don't know, will I be here when you start? I don't know.
Oh, well, hopefully.
Hopefully.
Thank you for answering my question.
Yeah.
They told me you'll be the first Asian male in 25 years to be admitted.
That's amazing. Yeah, and we don't even have.
I went through the hallway. My parents came with me to the vet school open house, and my mom, she made me to take a photo of her next to all the pictures with her sunglasses on. I was like, why are you doing this? Just take the picture, Mark. And she put in her Instagram, vet med is so white that the white's blinding.
I like your mom. I need to meet her.
And she didn't believe me. She didn't believe me until she went around, because she's like a human doctor herself. Is like, how did your field allow this to happen?
That's a great question. How?
And one we probably don't have the answer to right now. We're all as confused as her.
I mean, I think we can just say like systemic racism, right? Just kind of leave it at that.
Yeah, yeah. Your mom's a savage, Mark. I absolutely love that. Are there any other questions? We have one in the chat. Are you aware of the KVSA?
No, I'm not, and I'm embarrassed to say that, but I'll need to look into that. I'm assuming that stands for like Korean Veterinary. I don't know what the S is. Student
Association?
I don't Korean. Karen, do you know?
Yeah, you're right. Oh, Society of America, just kidding.
I was so far off. Okay. Yeah, I'll have to look into that.
Yeah,
I feel
Jean,
like
do you
my
want to?
attendance, Esther, like, are you similar? I feel like my attendance in like any sort of like Korean association has been very minimal.
Yeah, like even in college,
When I was younger.
even in college, like I was never a sorority girl, and like I remember like one of the Asian stories tried to like recruit me, and I was like, no, thank you. Like I just don't.
Yeah, they hunted me down in my dorm, and I was like, no, thank you.
Yeah.
I don't have time for that.
Hey, I unmuted myself, but I don't know if you can hear me. I'm on my walk home from work.
Yeah.
Yes, we can
I'm
hear you.
Matt. Cool. I'm a veterinary dentist in the Bay Area. My dad is a retired GP veterinarian from Philadelphia. So I grew up in the KVSA. Mostly immigrant Korean veterinarians, but some mixed in terms of educated in the US. But they are mostly actually in Southern California, but they're essentially throughout the US, and they have a meeting every year in the LA area.
Oh, fun. That would be easy. My parent is just an excuse to like visit my parents too.
Yeah.
Yeah.
Do you know, Jean, if they're doing anything virtual now because of the pandemic?
I don't know. It's really bad. I'm actually quite a bit older than all of you. I'm in my mid-40s. But I don't actually read Korean. I grew up in Philadelphia, so we don't have as big of a Korean population. But they do have a lot of things. My dad used to be very active. He was the president of the East Coast section of the KVSA. And he occasionally sends me a newsletter, but I can't read it.
All right. Well, definitely something we will look into more to be able to share with our members, because I think that would be a great resource for them. So thank you for sharing that.
I know
Jean.
they're,
Is this
I
the
know
thing in
they're always
LA?
looking for
Is this the thing in
younger
LA with all
members.
the vets?
Yes.
Okay. Yeah. Well, one of our dentistry residents is Korean. And then we have actually like a couple of other Korean like residents here. Like she was in behavior, now she's back in Korea, and they were trying to recruit me, and I was like, no. And I also don't have time to. But I was like, no, thank you. She like hunted me down, and I was
I don't have time.
I don't have time, and I don't want to.
Wait, Karen, where are you going after? Like, what are you doing next?
That's so funny. So I'm still on the job hunt. I want to stay in academia. And so I've applied to a couple of academic places, like ironically out in the Midwest. So again, representation is minimal, but I'm used to being like the only Asian in like a very white conservative area. I think most of us are. And then NC State has a soft tissue position open that I just applied for. We'll see. I don't know. We'll see. We'll see where that goes to.
Come back.
So we'll see. Yeah.
Cool.
Awesome. Do we have any other questions that we can ask Dr. Farber? Ooh, another one. How do you recommend finding an API mentor in vet school? Also, do you have any recommendations for connecting with other Asians, especially in very white areas? COVID has made it difficult to meet other students.
Oh yeah, going like to the last question or last statement, I can't imagine how tough it must be for students this time. Like it's vet school is hard enough. It must be even harder not actually being able to like be around each other, because you're supposed to become a family at least when you're together. But anyway, so I feel for you guys. In terms of finding mentors, I'm not sure I'm the best resource to do that.
Can I pop in here?
Sure.
So Sarah, and for everyone here, one of the big initiatives that the Aavmp is doing is we have actually started to establish a directory of AAPI veterinary professionals all over the United States, and then also outside of the United States. And so we just elected we'll explain that soon, but we just elected a global outreach coordinator. So she's going to work to make our directory more international. And then we also elected a mentorship and leadership coordinator, and he's going to work with expanding our directory on a national level. And so what that provides is anytime we have someone added to our directory, Dr. Farber's in there, a pin pops up on our map on our website, which we can link afterwards. And so you're able to access that. And then everyone answers the question, are you willing to mentor pre-veterinary students, or recent graduates? And most people say yes to that as well. So if you, Sarah or Hannah, are looking for a mentor in your area, feel free to email us at asiansinvetmed@gmail.com. And I'm happy to look at that directory for you and find someone who's hopefully within driving distance in your area, but if not, close enough to you that you can strike up an email conversation with them and then maybe plan a time to go out and meet with them. Yep, exactly like Mark said, slide into the DMs and be active in the relationship. But yeah, and so that's something that we're actively trying to work on. It's growing every day. We get about 1 or 2 submissions. So definitely something we can offer to you. Another thing we're doing right now is we've got about 10 prospective Aavmp chapters set to open in the fall at a lot of the universities. We've established our first one just recently at Cornell. And then we have, I think, Texas A&M, University of Illinois, and a lot of other ones that are Oregon State, and a lot of other ones that are escaping me right now, Tufts. And so what we hope by the end of the next year, 2 years, a tangible goal for the Aavmp would be to have a student chapter at every university to make that time in veterinary school just a little bit easier. Again, like Dr. Farber said, it's so difficult. And so maybe to have a group of people where you can relate to on a more personal level, and another group of friends to have in veterinary school, hopefully that makes it a little bit easier. So if you're interested and you don't know if your school's starting one, again, feel free to send us an email and I'm happy to talk with you, set up a Zoom call and we can get that all working. But we'll have a manual out by the middle of summer so that we can hit the ground running in fall and get those chapters started. So hopefully that answers your question. Yes, I don't think we have one at WSU. So if you want to message me, that'd be great. And then the mentors do list their interest and specialty area. Most are GP. We do have a lot of oncologists, a cardiologist, Dr. Farber is our resident radiologist, and a few others. So ECC as well. So yeah, we do have a wide variety of specialists. And again, we're looking every day for more. So feel free to just send us an email after this at asiansinvetmed@gmail.com and I'm happy to connect you. Let's see, did I miss anything else? Oh yes, Karen, the website, we have a link here if you can put that in the chat for the type form. It's just like a little type form that you fill out, your name, your position, where you're going, and your address and your contact information.
Okay, I guess my question was, I was looking at the site right now and like for my contact information, I pop up, but when you click on my name, there, like the only contact information is the UC Davis information, and then when you click my name, it just goes straight to the UCD website.
Yes.
I don't know how much that's going to help someone trying to.
I have the personal information on a Google spreadsheet. Not everyone wanted their information, like their phone numbers and emails out there, so they can just see your location and where you're located for your bigger parent university. And then if they want to work with you directly, they can just send us an email and I'll pass along your information and connect you guys via that.
Okay, perfect.
Do you want me to change that for you on there?
No, that's fine. I like it. On there.
Exactly. Just trying to keep y'all safe.
I'm just curious, someone here who wants to do radiology or like has any sort of interest? I feel like people either love it or hate it.
I'm kind of interested in it, and I wanted to ask you about it because, oh, by the way, so I'm Hannah. I'm currently a 4th year at Cal Poly SLO, so I'll be graduating this summer, and I'm currently applying to vet schools right now. I did last year, but that didn't go through, so this year I'm reapplying again. And I was looking into specialties, and radiology and like surgery were 2 of the ones that I had an interest in. And but because of COVID, it's been really hard to even get like even a clinical experience. Like I was volunteering at a shelter and they closed for like about almost a whole year last year because of COVID. And so I haven't been able to get enough clinical hours. But I guess one question before you mentioned about like how to get into radiology, for me, I wanted to ask for like incoming veterinary students who plan to apply or will be attending school this year or next year of Asian American descent. So I'm Korean American. I guess what are some advice you would give on ways to adjust and adapt to like new environments? Because I know, because I'm from California, and so Cal Poly is definitely, it's a PWI. We've had a lot of unfortunate racist events here. So I definitely know, like I definitely relate to the experiences that you mentioned about, you know, feeling like you're the only one, especially in vet med. And so I guess what are advice that you could give to kind of just adapt and adjust and like not be so overwhelmed, I guess, in that kind of environment where you feel alone?
Yeah, I mean, vet school is tough. You know, it's this, you'll hear this a lot, but it's like, you know, drinking from a fire hose, and that's just like the learning part of it, right? I feel like what really helps is to find a group of people, whatever race, you know, just find a group of people that you click with and find and have like a common interest with, right? It doesn't, you know, again, it doesn't have to, you don't have to have someone who's Asian American. Obviously, it's helpful, but just find a good group of people. I think every school is different in terms of like how many people are in each class, but most of them are like in about 100-ish, and they become kind of like one big dysfunctional family. You don't have to like be friends with everyone, but your vet school family is really your family for those 4 years. And so I would, you know, I think it's important to have people, however many people it is, that you can rely on to get you, you know, to get each other through it.
Yeah, going off of that, I moved to the Caribbean for veterinary school. That was a change coming from Los Angeles and then moving to an island. It's difficult at first to meet an entirely new group of friends, but nothing you haven't done before, going from high school to SLO and then from SLO again. What I would recommend is just to be as open and as welcoming as you can, and to try to demonstrate interest in everybody's lives, because everyone in vet school has a unique path to how they got there. Some people went directly, some people took years off, some people had a second career as veterinary medicine. So just meeting them that way and just kind of like putting yourself out there, as scary as that can be. And then also understanding that as you go through vet school, your friend group will change. Who you're friends with in the first year is not who you're friends with in the last year. And so not also trying to hold on to those friends, understanding that as you grow, because it's 4 years of insane growth, and it gets even crazier as you go for more training. Just like being open to that and welcoming the growth that comes with it. And then, just being adaptable and putting yourself out there is the best that I could say. If anyone else has any advice they'd love to share, I'm sure it's welcome.
And I guess I'll jump in. None of my friends at the University of Florida are Asian or of Asian descent at all, but they are all very welcoming and kind of support me as I share things about my culture with them. So we kind of like, I'll cook them like specific Pakistani food and they absolutely love it. And then they'll cook some of their food later. And we had like kind of like a diversity potluck in the beginning of the year before COVID. When was that? I don't even remember anymore. But we just had everybody from all different races come together and just meet in one little spot. So that's always something that you can do with people, not just in your vet school class, but also in the classes above you. And everybody's kind of feeling the same way about finding their group of people. So remember that you're not alone in this journey.
I think someone said in the chat, but it is good to have friends out of vet school. Like you don't have to stick with that group. Like sometimes it can be a little too much, right? Like it doesn't always have to be vet med 24/7. So like it might help to, and this is just like a maybe, like to have a roommate who's not a veterinary student or involved in the vet profession at all.
Thank you.
All right. Do we have any other questions? We're having quite an interesting discussion in the chat. But, you know, I'm glad that we all have each other to know that, again, we're not alone in these situations and that we've all experienced it, and we can all find a little bit of levity in the situation, because sometimes I guess that's the best way to deal with. Otherwise, you'd be a little sad all the time.
Dr. Farber?
Yes.
So I noticed this along the way when I was researching for financing veterinary school, that there are very little scholarship just dedicated to minority veterinary students, but there are like 25 horse veterinary scholarships that go exclusively to, for some reason, white girls from upper middle class backgrounds that don't need the money. And I brought that issue up, and they just said, well, sorry, but I was like, I asked the American Equine Association, do you think you need like a diversity consultant to rephrase those scholarships? Because it just hints that you need to have a horse and have horse interests. And I already told this, it's like there's up to $67,000 in that pot for American Equine Association, but less than $17,000 dedicated for minority vets.
Yeah, no, for sure. Oh, sorry, were you gonna talk more? Okay. And it's funny you mentioned the 60 whatever thousand, because one of my classmates that I'm good friends with, white female, got one of those huge scholarships, and they're like, that's just ridiculous. That's a lot of money. But yeah, and it kind of goes back to, again, like systemic racism leading to the fact that horses are a very expensive white person sport. And that again follows into white women follow, some of these people who ride horses end up going into vet med, and then it all just they all benefit off of each other. I think we just need to make a lot of money and make our own scholarships and hand out our own scholarships to API. Yeah, again, I think it kind of goes back to leadership. We need to fill these positions of leadership, and we need to kind of make change from higher up. It'll take time, but we got to start somewhere.
Yeah. Here also said again, and like you mentioned earlier, the model minority myth, I think, plays a big role into that, which is unfortunate and something we're trying to change. And then we also just elected a scholarship awards and grants director. So hopefully within the next few years, the Aavmp itself can start to turn out some scholarships that we can offer to support our community, because Mark, like you said, it's lacking, and it's lacking a lot. So again, hopefully something that we can provide the community with. But I agree, Esther, we need to have that change in leadership. And we need to use, I think, the momentum we have right now to start to get those changes going. So.
Yeah, Vane had a scholarship essay based on diversity, and they only, for the first prize, was $1,500. Like, how much that will ever make a dent in our veterinary school debts? And I brought that up, and they had like a whole picture, and I raised like, all of them are white, but you're doing a whole essay on diversity. Did you have anyone look over this before you released it? And they're like, oh crap, we did it.
I think we need more people like you to speak up. I'm being totally serious. Like, we need more people like you in vet med. Just like call them out.
Yeah, you're doing the good work over there, Mark.
No, I'm doing this a Filipino event this coming Saturday. I got so many deans telling me, Filipinos, isn't that kind of a niche audience? Wouldn't you want to like settle for like API in general? And I was like, no. And the things they put in their registration information, they asked the panelists, can you talk about the rise of recent anti-Asian trauma and killings? And I was like, no, we want to center our joy and brilliance, and Google is free.
Good for you.
It's a very prominent dean of a very prominent West Coast school.
Oh, geez.
I don't want us in trouble.
Let's see, are there any more questions? Sarah asked, what do you think we can do now as students to make change happen?
Ooh, I feel like I need to open this up to everyone, because I don't know if I have the right answer. I think we need to make our voices heard. That sounds really cliche, I guess, but I don't even know how else to phrase it if anyone has a better way to say it.
No, I think you're right. I think it like goes back to what you were saying earlier, Esther. You know how I feel like maybe it's also because of the sheer numbers, just because like, I mean, I was the sole Asian in my class. You were too right after me. And it's not like you and I had much interaction. it probably is because of the numbers, but I feel like we need to be better about coming together and sticking together, which at least like in the general Asian community, I think it's easy for everyone to come together. But if you look at how people tend to come together, stick together, we all tend to not be as vocal, because I certainly like am similar, where like I experienced a lot of racism, and either I just stayed silent or I kind of like went along with the joke and fed into it, versus like now, if like now I don't take it, and even if I saw somebody like being a victim too, like I would pretty much speak up and probably react really angrily and end up potentially even offing somebody. So I think we just need to be better about like coming together and supporting each other as a group. And I think the like, and kind of going against culturally how a lot of us were raised, in terms of like kind of like keeping your head down, being quiet, being silent, and just working hard or protecting yourself and not getting hurt and involved. I think at least like those of us that know, we need to at least like actively take the stand to like protect one another and stand up for each other. And I don't know if it means like like coming up with more groups like this, so that at least people know that there is like a group or society to turn to in vet med, or I don't know.
Yeah. And like, I don't know about you guys, but like with everything that's happened this past year, and then like more, more recently, like, and this might just be me, but like, this is the first time I've ever actually like been afraid, and I think it sucks that we have to like, that it takes so much trauma to bring us together, but if that's what it takes.
No, I absolutely am afraid. I'm moving to Georgia. Really excited for my rotating internship, but
In Athens?
yeah, in Athens.
Oh, I did my rotating internship there too.
Woo, did you like it?
I loved it. I could
Okay.
not have asked for a better, like I'm in my residency because of faculty there. And
Okay.
do you want to specialize in anything?
I'm thinking Medonc. I really like Medonc.
Oh, Medonc. They have an awesome team there.
Amazing. Okay.
It's
So
it's
excited.
awesome. Yeah, it's awesome. But they like Bug, if he's still the
Yes.
intern, Bug
Yes.
will protect you with his life.
Oh,
He is
bless.
not afraid. He like I love him so much. And like he can like become super angry to protect his interns, and he gets away with it. And he knows he gets away with it. And it's awesome, like the amount of protection you get, which I can also like talk with you about it separately, because I had some incidences too in Georgia where like I had an old white dude like put his hands on me and get very like in a very like aggressive way, where even the police were called in, and at the end of the day they were like, well, we have to go with what he says, even though like what was on camera, it was like a bad situation. And a couple of other things, which like things didn't work out that way, because even if it was reported, because it's typically like Georgia, in the South, but
I'm really sorry about
will be
that.
protected, and they have an awesome team there.
Okay.
But yeah, we should chat so I can tell you all.
Let's chat. Absolutely. I'm gonna shoot you an email.
Yeah.
Okay.
This, like, look how much we're just connecting. Just
yes, I love that. Oh, wow.
I mean, coming from the Florida perspective, I get it. Coming down south is definitely hard for any person, an AAPI person. So Georgia's not too far away from Florida, so I got you.
Thank you, Hira. Okay. I think if anyone else has any last questions, now would be the time to ask them. While we wait for those questions, if anyone had to leave early, or if anyone wants to watch this again, because Dr. Farber and Dr. Park and everyone here shared so many incredible words of wisdom, we will be posting this on our YouTube channel. And so look out for the link for that in the coming days. We also have some awesome other panels coming up. Next week will be Dr. Tokiwa and Dr. Kim, GP and a specialist. Dr. Kim specializes in medical oncology, and they'll be talking about how GP and specialists can work together and kind of have that kind of thriving relationship. The week after that, we'll have a social worker. Hira, do you want to give a quick blurb about that?
Yeah, sure. So we're going to have Dr. Angie Aurora kind of talk about how we can maintain our wellness and our mental well-being while also facing kind of the oppression that we get from systemic racism. So that's going to be a pretty intense noontime talk. So if you wanted to get woke during lunchtime, that's definitely the place to go for that. And then our final talk is going to be our wonderful Effie and our other founding board member, Kelly. So they are going to talk about what it's like to be of mixed AAPI descent and kind of the struggles and the unique challenges that come with that. So
those are our events. Look out for those. Dr. Farber, do you want to introduce that beautiful dog to us?
This is my very oversized cardigan malt corgi that people insist is an Aussie mix. So tired and like being a dead bug essentially.
Oh my gosh, absolutely adorable. Looks thrilled to be on camera.
I had one, I guess, last question. So for me, so since I'll be graduating this year, and I'm going back home, I live in Sacramento area. Do you have like advice on like how to gain more experience? Because for me, I've done the typical like walk in, hand in a resume at like a clinic and saying hi. I wouldn't mind shadowing or volunteering, but because I'm probably taking a gap year, finding a position that would actually pay, or like even if like I could just do more hands-on stuff would be great. But because of COVID, it's hard, and so emailing hasn't really been the best way of communication. And so I don't know if anyone had advice on that. Or
I think the chat is kind of popping right now, Hannah, for Karen. Dr. Park is saying that, she's willing to connect with you. She's in the California area in Davis. And Mark mentioned how Banfield is always hiring. And I think that a common thread, especially with pre-vets trying to enter vet school, is finding the experience in light of COVID and how that's been incredibly difficult. So I think that application committees will understand that, and admissions committees will keep that in mind, because these are, and I know we're sick of the phrase, but unprecedented times. And it's definitely a challenge, but you've got lots of advice here. I don't know if anybody else has anything to say.
Yeah, Hannah, I guess
I actually have a different perspective on that. In private practice, we are dying for help. And I know that we are currently looking for warm bodies. So we're hiring vet assistants like crazy in the Bay Area, and I think in Sacramento probably as well. So it's hard because they're not looking for people to shadow, especially right now with COVID, but they are looking for people to work.
Yeah, and Hannah, I don't know what the situation with testing is like anywhere else, but at least here in Davis, you can like get tested pretty easily, just like sign up and get tested. And then that might help in terms of like getting at least a job, at least in like this Sacramento Davis area is been my experience. I think at the VMTH, I don't know how open we are in terms of jobs and shadowing, but the local clinics are, I mean, there's like even a specialty hospital and a new hospital like every single block from like Sacramento all the way to the Bay Area. So
also consider doing large animal medicine and doing ride-alongs, as it's open air and you can travel in your own car and meet the veterinarian at the farm sites. That's still considered veterinary supervised hours. And go into unconventional fields like laboratory animal medicine. It's so clean and it's all PPE. And that's a perfect way to get veterinary experience. As a former vet tech at a laboratory animal facility at a major research university, we always have pre-vets coming in and just shadowing the residents or the vets. Like UC Davis has one of the renowned lab animal fields because they have all the animal science facilities and they have the primates.
Yeah, and like it's been a while since I've applied to vet school, but I think the diversity, as Mark mentioned, diversity in actual like experience is really important. So like don't limit yourself to small animal medicine. Like do weird things, like go to, even like shelter medicine is different enough from just like small animal GP. Yeah, like the large animal idea is great too, for sure.
Yeah, definitely. I also want to open my horizon and do other stuff like large animals. I actually emailed to like volunteer at the Sacramento Zoo because I was like, that was something I wanted to do, but because of COVID, I don't know if they're even opening or allowing volunteers. But yeah, I guess referring to Mark, is that this sounds like a dumb question. Is it like you just do a Google and then there's like clinics or certain places?
So for a ride along, give me your email, I'll send you my ride along tips.
Okay.
I wish I learned about this, but be sure to network with people. Cal Poly, you have all those white girls in animal science. They must have a horse. So
they do. They all do.
Have them use their privilege. And it's like, hey, I got a girl named Hannah. She wants to come to be a veterinarian. Next time you connect, let me know when your horse vet comes so I can get an introduction. And then they'll like, okay, my client knows you. You're not the killer. So let's connect and let's do like once a week or like a month. And just be handy, be interested, and stay out of the way. That's the most important thing. And just ask questions because nothing's more boring and awkward than sitting in a truck and no one's talking.
Okay, got it. Well, thank you for the advice.
I love all of the connections we have made in 1 hour. Is this not incredible? I'm absolutely loving it. It's making me so happy. Okay, I think that will wrap it up. And so again, we'll have this talk recorded and posted on our YouTube channel, hopefully within the next few days. Dr. Farber, thank you again for sharing your insight and the experiences, the good and the bad that you've had. I think that was really helpful for all of us to hear. If anyone has any other questions and you want me to direct them to Dr. Farber afterwards, just shoot them as an email to asiansofvetmed@gmail.com. And I will connect you guys because she is full of wisdom and knowledge. So make sure you capitalize on that resource. Thank you all for coming. I'm so excited. That was such a great turnout for our first event. Looking forward to the rest of our events. And again, thank you, Dr. Farber, for everything and for sharing with us. It was really awesome.
Thank you so much for having me. This is a lot of fun.
Awesome. All right, everyone, have a beautiful night. Nice to see your smiling faces and name boxes, and talk to you all soon, okay? Bye.
Thank you so much.
Bye.